Hey there, my friend. Dr. Paula here. If you're a new mental health counselor, or maybe you've been in the industry for a while already, you'll want to tune into this video as part of your overall wellness plan. Today, I want to walk you through 10 soft signs of professionalism lapses that will give you a framework that you can use to effectively monitor yourself in your practice. Before we start, let's admit that as mental health providers, we hold ourselves to some pretty high standards. But even dedicated professionals can experience lapses. These lapses often emerge gradually, and they can be easy to overlook or rationalize. It's really important that we recognize these subtle signs early so that we can take proactive steps to address them and prevent the negative impact that can occur for our clients and our practice. Remember, all professionals make mistakes and face challenges. And professionalism is not about being perfect. I know that if you follow and tune into these signs, then it will have a positive impact on your work. So let's dive in. Here are the 10 soft signs of professionalism lapses. The first of the 10 signs is chronic lateness to sessions with clients. When the issue is chronic, it's not related to any particular client or personal emergency. Being late reduces the effective time for the service, of course. But even if the session time can be extended, clients can have emotional reactions because of the way in which they were treated by past caregivers that were unreliable. It can also reduce their trust and evoke feelings of inequity. The second sign is the neglect of paperwork and other administrative tasks. Sure, many therapists will admit that this is not their most favorite part of the job. Some will prioritize direct client care over administrative duties, and many therapists have demanding schedules with back-to-back sessions. Documentation is a key part of the role, and neglect of admin tasks has the potential to impact clients negatively by failing to create an accurate record. The third sign is the avoidance of certain clients or types of cases. Note that this sign is not referring to the boundaries that we set as therapists with respect to our expertise. Instead, a therapist might be consistently avoiding difficult cases as a way to navigate their stress, or as a way to avoid using supervision or consultation to work through difficult or complex ethical dilemmas. While this pattern is unlikely to harm clients directly, it may be a subtle sign that a therapist is using less adaptive coping strategies. In this way, it's an important early marker to tune into and act on. The fourth sign involves frequent rescheduling of appointments, which can occur with the same client or with different clients. What we're not referring to here is those occasional cancellations that happen because of personal or client crises, or other types of professional obligations like training or conferences. Instead, what we are referring to are those times when therapists have overcommitted themselves, or they struggle with time management, or maybe they feel burdened by their work schedule. And as a result, they turn to rescheduling as a way to cope. This type of coping strategy will negatively impact the consistent environment that clients need. And so it's important to tune into this particular sign promptly. Forgetting important details about clients is the fifth soft sign of the lapse of professionalism. While occasional forgetfulness of minor details can happen, consistently forgetting major life events or crucial aspects of a client's history is a serious concern. It can come about when therapists are not fully engaged or paying attention to a client's experience or needs. Treatment is also less likely to be effective under these kinds of conditions, so it's a sign to tune into quickly. We're at the halfway point in the list of 10 soft signs of professionalism lapses. How's it going so far? Leave a message in the comments below. The sixth sign occurs when therapists persistently feel irritable or impatient during sessions. Occasional feelings of impatience do occur, but consistently experiencing them on a regular basis or acting on them is a matter of serious concern. This sign is highly disruptive to the process of therapy. It impacts the safety in the relationship and therapists will be unable to listen fully. It can also lead therapists to schedule certain clients less frequently or to end sessions early. So it's an important one to tune into quickly. Boundaries are the cornerstone of therapy, and so it's not surprising that the seventh sign of professionalism lapses is the difficulty to maintain them. Setting aside serious violations such as sexual involvement or inappropriate physical touch with clients, the more subtle signs include discussing personal problems, excessive self-disclosure, and engaging in business relationships with clients. Clear boundaries help preserve the integrity of the therapeutic relationship and to maintain public trust in the profession. Lapses are highly damaging to clients, and so rapid action is needed when these subtle signs appear. Empathy is a vital tool and skill for engaging clients and working with their emotions. So it's not surprising that the eighth sign is decreased empathy or compassion for clients. There are a number of reasons or situations that can contribute to a reduction in empathy. It's crucial for therapists to recognize signs of empathy reduction and take proactive steps to maintain their professional standards and effectiveness. We're heading into the final stretch of this list of top 10 signs of professionalism lapses, with only 2 left to go. If you haven't left a comment already, please take a moment to do so now. The 9th sign is difficulty concentrating during sessions. Now, all of us, of course, will encounter momentary lapses of concentration, but persistent lapses should be an area of monitoring for clinicians. Many factors will influence concentration, but when it happens consistently, therapists can miss vital information related to clients' well-being or safety, which can compromise quality of care. The 10th and last sign is feeling overwhelmed or burned out. Burnout is a complex issue that results from a combination of personal, professional, and systemic factors, and it requires active management and support to address it effectively. Many factors contribute to the development of burnout, including vicarious and secondary trauma, high workload, and limited professional support. Many of the soft signs in this list, such as difficulty with memory and attention to detail, emotional exhaustion, avoidance, reduced empathy, self-doubt, can also be signs of burnout. Burnout is a serious issue affecting many therapists, and recognizing these signs early is crucial for preventing the detrimental effects on personal well-being and professional performance. Remember, professionalism is not about being perfect. All professionals make mistakes and face challenges. It is our commitment to self-improvement, ethical practice, and self-awareness that sets us apart. By regularly monitoring ourselves for these soft signs, and by taking proactive steps when they occur, we can protect our clients, our practice, and also contribute to the integrity of the profession. Thanks for sticking with me right to the end. Tell me what you think. Leave a message, like this video, subscribe to the channel, or maybe share with a friend. So now that you have these 10 signs in mind, you're ready to think about what those proactive steps will be in order to respond to them. These steps are covered in the next video. See you there.